All right, so for our clinical case study, we got the shoulder, and this is brought to you by Matt, Kyle, Logan, and myself, Jackson. In this case, a 43-year-old woman named Sarah is complaining about shoulder pain she has been experiencing. She expressed that she had begun playing tennis recently and putting in a lot of time improving her overhead serve. She had been experiencing the pain in her right shoulder, and the pain has carried over into the rest of her life. She has discomfort while sleeping on her right side, has pain while lifting groceries, and also while blow drying her hair. She has noticed significant weakness in her tennis serve also. Sarah said that she was feeling relief when she watches TV, and her injury does not affect her to the same degree when she's at work, which she is an accountant, but it is still evident that she still experiences discomfort. Our goal is to find out what she has and hopefully bring her shoulder back to normal. A few possibilities that we've narrowed it down to what she could have is bicipital tendonitis, rotator cuff tendonitis, subacromial bursitis, or SLAP lesions, which is superior, labrum, anterior, and posterior lesions.
So based off of her pain and symptoms, we believe that she is suffering from rotator cuff tendonitis. And rotator cuff tendonitis includes pain that is present both while active and at rest. Another symptom of the pain would be while performing lifting and reaching movements. Also, athletes that have pain when throwing or serving a tennis ball. We do not believe she is suffering from bicep tendonitis because she is not experiencing pain in the proximal tendon of the bicep, nor is she experiencing the pain when we are also tossing out the idea of the subacromial bursitis because she does not have the pain because she has the pain within a full range of motion. Whereas the subacromial bursitis, you experience pain between the 60 and 90 degrees of the shoulder movement. And shoulder pain is often relieved once the arm is above the shoulder line. Sarah has been experiencing the pain in her right superolateral shoulder region. This was caused by her working excessively on her overhand serve in tennis. We have diagnosed her with the rotator cuff tendonitis due to the fact that she's experienced pain while sleeping on her shoulder and lifting with that shoulder. We also ruled out certain traumas from that region, and because of that, we believe that it's not the SLAP lesions, because that's usually due to some type of traumatic force upon the shoulder, which causes the tear.
As far as treatment, rotator cuff tendonitis can be easily cured in a variety of ways. First step of action would be to stop playing tennis until the pain subsides, and then while not playing tennis, you should apply ice to her shoulder, and she should begin taking anti-inflammatory drugs and begin an exercise program to increase shoulder strength and maintain shoulder flexibility. If pain continues, then the next step would be a cortisone injection. If she follows these steps above, then her rehab time should be about 2 to 4 weeks. If pain still has not subsided after that time period, then the next step would be surgery to reduce inflammation. Exercises to increase strength of the shoulder and maintain flexibility include the pendulum exercise. Do this 5 to 6 days a week for 2 sets of 10 reps. The next exercise is the crossover arm stretch. Do this 5 to 6 days a week and 4 per side. These exercises target the supraspinatus, subscapularis, infraspinatus, and the teres minor. These are the 4 muscles that make up the rotator cuff. It is important to strengthen these muscles so they take the strain of physical activity rather than the tendons. Strengthening the muscle will also help prevent any further damage to the connective tissue as well. These exercises need to be done on a regular basis for them to be effective. So this is just a picture showing the scapula and the rotator cuff muscles, which again are the supraspinatus, subscapularis, infraspinatus, and the teres minor.
Due to Sarah's injury of the rotator cuff tendonitis, it would be best if she stopped playing tennis for the time being so she can strengthen the muscles supporting the joint. So she should do her exercises 5 to 6 days a week for 3 sets of 10 to 12 reps, each week increasing the resistance. And one exercise she could perform is to keep her elbow close against her side and medially rotate her forearm to work on strengthening her shoulder cuff. And she can also do that by laterally extending her forearm. And after her physical therapist deems that her recovery has been sufficient, she can go back to playing tennis. However, she should keep doing her exercises and stop activities if pain reappears. And what can be learned from this case is how to prevent these injuries. The best way to prevent this type of injury is to not overexert the joint. It is important for athletes to have ample rest time to be able to recover from the stresses that they have put on their body.